As an intensive care doctor, I often get many phone calls within a short period of time about deteriorating or sick patients that may need to come into intensive care. It's my job to make quick but safe decisions on whether a patient should be admitted into intensive care. My name is Sal. I'm a senior doctor that's training in both intensive care medicine as well as kidney medicine. And I made this channel to go through topics that I think are not taught well in medical school or in medical training, which I hope will help you in your medical career. In this video, I'm going to give you a sneak peek behind the mind of an intensive care doctor. So how do I make decisions quickly on whether a patient has to come into intensive care? Once I've taken a phone call about a deteriorating patient and looked the patient up on the system, I normally have a very good idea on the patient's current issues as well as current treatment requirements. And with this information, before seeing the patient, I'm already in one of two mindsets. And the first mindset, without even seeing the patient, is to admit the patient unless there's a strong reason not to. And the second mindset is to not admit the patient unless there's a good reason to. So when I go to see the patient, either in A&E or in the ward, whilst assessing the patient, I'm looking for factors and asking specific questions to support or deny that mindset that I had when I came into the room. So examples of scenarios that will put me in the mindset of admitting the patient unless there's a good reason not to are instances where a patient is already on more than 60% oxygen, or if a patient has got acute severe asthma, or if a patient is post-cardiac arrest. So just before going to see this patient, I will have informed my nurse in charge that there's a patient that's likely coming to us and please prepare a bed. Then when I go and see the patient, I'm looking for specific reasons that might go against this mindset. For example, if a patient has had clear indication that he will never want to step into ICU ever if he gets unwell, then there is a good reason to not accept this patient into intensive care. And an example that will put me into the other mindset of not admitting this patient unless there is a strong reason to will be, for example, if I get a phone call of a patient who is quite elderly and is very frail and has been bedbound for 3 years and not being able to walk or do any of his activities of daily living for a long period of time. Receiving this call will already put me in the mindset that this patient will not benefit from a period of intensive care, and therefore I will have gone to see the patient with the mindset of not accepting the patient unless there's a good reason to. If you found this video helpful, please watch my previous video where I go through specific factors that will influence whether I, as an intensive care doctor, will accept patients into intensive care or not. I hope that helps.